Good evening. I am Dr. Sarada Mamilla, consultant gynecologist and obstetrician, Yashoda Hospitals. Today, let's talk PMS. So, we all know this word PMS, be it in movies or in our office gossip or in our mega serial goof-ups. Somewhere in our day-to-day life, we hear this word PMS. Most of us do not know what it is, including most of the medical professionals. But we all have a vague idea that it is some girl thing related to periods. Yes, today let's talk about this girl thing, the PMS. So what is PMS? PMS, premenstrual syndrome. Many women feel physical or emotional changes days before menstruation, and after menstruation these symptoms just go away. So this is called as premenstrual syndrome. How common is PMS? Yes, so it is as common as 3 out of every 4 women. That means 90% of the women, 3 out of every 4 women do experience some symptom of PMS. What are the common symptoms of PMS? So we see many women complaining of headache, irritability, abdominal pain, food cravings, stress or anger just before the periods. So these are all emotional and behavioral signs. So these include tension or anxiety, depressed mood, crying spells. So women suddenly cry before the periods. Lot of mood swings, irritability or anger, appetite changes and food cravings. So lot of food cravings. Trouble falling asleep. So loss of sleep. There can be social withdrawal, poor concentration, change in libido. And also some physical signs. So not just emotional symptoms. They also have some physical symptoms. So what are they? Like joint or muscle pain, lot of headache, fatigue, weight gain. There will be weight gain because of fluid accumulation in the body, some abdominal bloating. Many women do have breast tenderness, so they complain of pain in their breast, acne flare-ups, so a lot of acne flare-ups to come, constipation or diarrhea. So now, does all these symptoms, should we have all these to call it a PMS? No. So to diagnose PMS, we have to say a woman must have at least some of these symptoms 5 days before the period, and at least 3 menstrual cycles in a row. It's not that in one time you had and next month you did not have. So in 3 menstrual cycles in a row, the women should have these 5 of these symptoms 5 days before the period start, and they should end within 4 days after the period starts. So the period starts and within 4 days, even though the bleeding continues, the symptoms should stop. Then we call that a premenstrual syndrome. And these symptoms should interfere with their day-to-day activities. Now, how do we know that these symptoms are coming every month? So there's something called as premenstrual diary. Your doctor will ask you to put up a diary. A diary is something like this. It contains the symptoms and the dates, and you mark your menstrual period dates and also the symptoms, when actually you had the symptoms, before the periods or after the periods, and how bad are these symptoms. So why should you maintain this diary? So the doctor can diagnose whether you are having PMS or some other disorder, some other condition. So can there be any other condition? Yes. So now coming to the biggest myth that any mood swings or any mood changes in a woman is because of premenstrual PMS. No, not all mood changes, not all mental tensions a woman goes through is because of PMS. Don't ignore the other big dangerous things. So there can be depression, there can be anxiety, there can be thyroid disorders, there can be a chronic fatigue, there can be irritable bowel. So any of these things can be there, and these symptoms mimic like premenstrual syndrome. So you have to maintain a diary and check. You have to maintain a diary and check whether it is premenstrual syndrome or some other thing. Now, can we treat this PMS, premenstrual syndrome? Yes, we can treat the premenstrual syndrome by lifestyle changes. So what lifestyle changes are required? So it is that all the doctors say that you should exercise regularly. So exercise is the biggest help which a woman can get, especially in a woman who is suffering from premenstrual syndrome. So what exercise should we do? We should be doing aerobic exercises like any of these, brisk walk or running, cycling, swimming, any of these things which increases your heart rate. So that gives you a positive chemical substances and takes care of this premenstrual syndrome. So you should be exercising at least 30 minutes in a day for most of the days in a week. Maybe a day off you can take, but most of the days you should be exercising. Then what are the other lifestyle changes? You need to take care of a lot of relaxation techniques. So what relaxation techniques? So we all say you can go for your yoga, you can go for your meditation, and any other relaxation techniques which you can, like any listening to music or some massage, or maybe there's a meditation. These things really do help you out. Any diet changes? Will the diet help PMS? Yes, definitely yes. So you have to include a lot of complex carbohydrates in your diet. Complex carbohydrates are whole grain cereals, whole grain. So you have to eat them so that it releases serotonin, a chemical substance which keeps you happy. And split your meal. So instead of 3 big meals, eat 6 meals, small meals. So that 6 meals keep your blood sugars on a steady levels and gives you a relief from this premenstrual syndrome. And include in your diet lot of fish oils. Avoid sugars, avoid salt, avoid oil. So these changes in the diet helps with the premenstrual syndrome. Can you take any supplements? Definitely yes. Calcium supplements and magnesium supplements do help with premenstrual syndrome, and the evening primrose oil helps with the mastalgia, that is pain in the breast. And you have to take care of your sleep. Try and get adequate sleep, at least 8 hours of sleep, and avoid caffeine, avoid tobacco, avoid alcohol. So by making these small changes in your lifestyle changes, definitely it helps for your premenstrual syndrome. If these changes do not help, then the doctor will give you some medicines, maybe some hormonal pills to take care of these symptoms. They can also give you some medicines for your mood changes, the depressive antidepressants. So those medicines you can use just when the symptoms come, 2-3 days before the periods, when the symptoms are very bad, you can use them. You don't have to use them throughout the cycle. And also in very severe cases, maybe you might be on a continuous hormonal therapies. So take care of your PMS, understand what it is, don't ignore the severe symptoms. So differentiate it from the other big severe diseases, and stay healthy. Thank you.